Hello, it's Bill, the knee pain guru. Welcome to, what is today? Thursday, September 26th, 2019. Today we're going to talk about how trauma affects your knees. We'll get to that in just a minute. We'll be answering questions after the short presentation. So if you have questions about what is going on with your knees, your diagnosis, surgery, physical therapy, whatever's going on, please put those in over in the comments section, wherever you're stuck with your knees. Those are great because it gives us more to talk about afterwards. It also gives me subjects and topics for future videos. I do these twice a week on Mondays and Thursdays on various things where people are challenged with their knees. Make sure to give the video a thumbs up, like, and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications for future videos so you know when those are happening. So the topic we're going to talk about today is how trauma affects your knees. And it's something that I was observing when speaking with a client this week. It's subtle. And it's very interesting because the more I've gone down this path of understanding what's keeping people stuck with knee pain, it's not their knees, which I find it incredibly fascinating because, of course, the whole focus for the conventional medical model is fix the knees, get a knee replacement, get a shot, drug, surgery, whatever that is, to address the knee. But in actuality, the majority of it is taking place up in our head or in our nervous system when you've gone through a trauma. And this is what happens when there is an injury to the knee. There is a trauma that the nervous system needs to integrate. And consequently, what happens is this trauma gets stuck in the neurology. The pain from the knee causes us to move differently. That's evident. There's more tension that goes up into the hips and lower back. We move away from the knee that hurts and we put more weight into the other leg. So physically, we begin to move differently. We also feel differently because, well, we have pain. So now physically things are changing. Emotionally, things are changing. And as a result, we have to think differently. We have to think differently about the way we move, about what we're able to do or not do, what we choose to do or not because of the knee. The knee drains and fatigues the body to such an extent that you wake up after a difficult night's sleep and now you're fatigued halfway through the morning. And you have to work with that the rest of the day. So there's this level of trauma that's stuck in the nervous system. And this is how it shows up. I was working with a client over this past couple weeks. And what will happen is trauma will make people want to do more across the spectrum of, well, I want to do exercise and change my diet and stretch and strengthen the legs, and I got to go to physical therapy. Like there's thing after thing after thing to do, but in actuality, there is no understanding of what works. And this is what keeps the brain kind of spinning and churning is the trauma. And I'm going to explain exactly what was happening. So I gave this client specific videos to watch based on where their knee was bothering them. They have issues with extension and flexion of the knee. And we're also looking at what's going on in the ankles and the hips as well, because it plays a role. We can't just isolate the knee and look at the knee. So these specific videos were about creating comfort in the knee and changing the neurological signaling. And the only thing they have to do is notice changes as a result of introducing comfort into the knee. So I asked, well, what did you notice? And they said nothing. Nothing. Like across the board, nothing. But the more I asked about each specific video, what they were doing, they're like, oh yeah, the one for the hips was really comfortable and I relaxed a lot. So in actuality, they did notice something. However, the trauma makes it this blanket statement that it's like, oh, nothing's changed. I still can't extend and bend the knee like I did before. So the trauma keeps us stuck in the loop, in the hamster wheel, that nothing is different. And we are not able to notice the distinctions and nuances, or that's not accurate. You notice the distinctions and nuances, however, the brain doesn't acknowledge that those distinctions and nuances are changing anything. Like there's any experience that's different. The other piece was that this client wanted specific modules to work with on a 3-hour car ride. So they had to go on a 3-hour car ride. Their partner was driving. They were sitting in the passenger seat. They had 3 hours to work on the modules to create comfort in the knee, get relief, notice some sort of neurological change as a result of introducing comfort to what was going on in the knee joint. Their response was, I only did it a couple of times. Okay, well, is the priority really the knee? And this is what happens. They will say the priority is the knee, but the trauma will kind of subvert the process and pull them out. All of a sudden, they have a 3-hour block of time to make a huge difference in how their knee feels, and they only spend a little bit doing it. And then I asked, well, what about other times? They said they didn't have time to do it. So you can see it on the surface, it would look like excuses. They're making excuses why they're not being successful, why they're not noticing anything. But I think it's deeper than that. I think there's a level of trauma that's going on in the neurology as a result of the actual knee injury. I mean, I know from my own experience, when I threw that softball to first base the last time, and my knee popped, and I dislocated my left knee for the 4th time, there's this gap where I don't remember from releasing the ball to first base to when I gained awareness that I was screaming, clutching my left knee to my chest. That's a level of trauma that the nervous system has to process on some level. And it kept me doing things that kind of kept me stuck in the same loop. And I want everybody to know, if you're stuck with knee pain and this is going on for an extended period of time, I was talking about how it changes the way we move, the way we feel, and the way we think. And when it changes the way we think, we make decisions. We make choices with this trauma that's stuck in the neurology that actually does things to keep us stuck, that keeps us in the hamster wheel. And how to get out of this. This is very interesting. It's like any other skill to develop. Whenever it's pointed out that, well, I asked you how it felt, and you're not noticing something, there's a deeper thing that's going on. Because the gap between you creating comfort in your knee and something changing is awareness. That's the only difference. It isn't that it didn't happen. It isn't that nothing changed. It's your awareness of what happened. That's the gap. That's what we're looking to bridge. And when we bridge that gap and you gain that awareness in what's going on, we have to slow down the process. Slowing down the process allows for distinctions and nuances to pop. Distinctions and nuances to present themselves to our awareness. And the more we rush through, the more that gap exists. And in some cases, it actually makes the gap worse because we're not addressing at the core of the issue. We have to slow down whatever it is. Is this making sense? If you have questions, please ask those in the comments section. How does this apply to you in what's going on with your knees, where you're stuck, where you're frustrated, where you find yourself over and over again in the process of trying to get out of knee pain, attempting to get out of knee pain, and you're still in the same place. So how is this playing out for you? Please enter those in the comments section, as well as whatever questions you have. If you like the video, give it a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications for future videos. So it's anytime there's a recognition of trauma, and it'll happen, you'll feel kind of that helpless and hopeless, like I've done this 1,000 times and I'm in the same spot. Then something needs to change. Something needs to happen. And if you're defaulting to stretches or exercises or what you've been doing and it's not working, well, like Einstein said, we can't solve the problem at the level the problem was created. We have to come from a higher level. I see it through the neurology. I'm recognizing it as trauma that's stuck in the neurology that prevents a lot of people from getting unstuck from the place that they have knee pain. Okay, we aren't getting any questions. We aren't getting any thumbs up. It's like crickets, like I'm the only one standing up in church, and that's okay. No big deal. If you want a next step from this point, if you aren't already watching this from the newsletter that I sent out this morning to my list, then go over to thekneepainguru.com and join my newsletter list, where I give perspective and advice and understanding, different opportunities and strategies to get yourself out of pain. You can certainly do that. You can also, if you're receiving this, below this is my group coaching program. If you're receiving this in my newsletter, below this is a button for my group coaching program called Knee Club. It's where I work with clients in a private Facebook group twice per week, on Mondays and Thursdays. And we go over strategies. So I would give you specific modules that would give you the relief, like I was referring to on my client. And that's where we zoom in on what was your experience. You create comfort in your kneecap. Your knee has pain. Kneecap has pain. You do modulate. How does that change that pain? Does it make it worse? Does it make it better? Does it move? Answers to those questions help us move you forward. We got a question from Lena. I like the word you're using. Hamster wheel, bridge the gap, find yourself over and over again in the same place. It describes it pretty good. Yes, Lena, 21 years since my own knee injury. And I don't see anyone else talking about it that way. I don't see anyone else getting to this level of specificity to customize programs based on what you have going on with your knee, whether it's knee pain, whether it's range of motion, whether it's scar tissue, or whatever diagnosis you have, even after knee replacement surgery. It's the key. And we can't look at just the knee. We can't just say, oh, the knee is bad, the knee is wrong, we got to fix it, without looking at the rest of the mechanism, the rest of the system of what's going on. It's like a car that got in an accident. We can't just look at where the car got hit. We have to look at how the tension has shifted in the car and how it's affecting the engine, the transmission, the cooling system, the alternator, like all of that gets affected with it. And in looking at the body, we can't only look at the knee. We can't only look at where the issue is, because when the knee is in pain, the rest of the body tenses up to compensate for the pain that's going on in the knee. Okay, we have our next knee club call in 18 minutes. So I'm going to be jumping off of here if there are no other questions. If there are no other questions, then I'm going to jump off and get ready for the knee club call. Please share this video with your friends, especially those who limp, because there's a lot of them out there. 9 billion people in the world. You're bound to know someone that limps, which means there's 18 billion knees. Anyhow, I'm going to scoot. Thank you all very much for being here. Have a wonderful day, and I will see you on the video next week.